Hey everyone, and welcome back for another deep dive with us. Today, we're going to be putting on some gloves and grabbing a stethoscope
Yeah.
because we are going to be talking all about patient safety and emergency preparedness in healthcare settings.
That's right. We're going to be taking a look at a certified nursing assistant training curriculum.
Oh, cool.
And really going to be dissecting all of the essential knowledge that these everyday heroes need to have to handle all sorts of situations.
Yeah, I'm really fascinated by this because, you think about it and it's like, wow, this is really like a crash course in caregiving.
Kind of like CNA for dummies, but way cooler.
Right. Exactly.
Yeah, and some really fascinating insights.
Totally.
And maybe even a few life-saving tips along the way.
For sure.
Yeah, I mean, you might be really surprised by the depth and the breadth of this curriculum.
I bet.
I mean, it really covers everything from, fire safety protocols to the complexities of oxygen therapy.
So interesting. Okay, so let's jump right in because I know you've got a ton of great stuff to share with us. Yeah.
Let's talk about emergency preparedness basics.
Okay.
If you've ever watched a medical drama, you've probably heard the acronym AREACE thrown around,
Right.
which stands for Rescue, Alarm, Contain, and Extinguish.
Yep.
But have you ever stopped to think about why it's structured that way, why those four, and why in that order?
Well, it's really brilliant, I think, in
Yeah.
its simplicity, right?
Right.
Like it's really simple and it prioritizes things so well
Yeah.
because rescue comes first. And that's because obviously protecting lives is always the top priority,
Makes sense.
right? And then comes alarm to get help on the way as quickly as possible.
Mhm.
And only then do you focus on containing the fire and then putting it out.
Makes sense, yeah.
Right.
So it's not just a random set of letters. There's actually, real thought behind it.
It's a carefully designed plan, right?
Yeah.
To kind of guide you through the chaos of a fire.
Okay, that makes a lot of sense.
And, it helps to avoid those common mistakes like, panicking.
Panicking.
So,
and
oh my gosh, fire, I need to put it out.
trying to extinguish a fire before everyone's out.
Right.
No.
Okay. Yeah, that makes total sense. It's very logical.
Yeah.
Okay, cool. So speaking of fire safety,
Yeah.
we've got another acronym, and this is actually one that I find to be really useful.
Okay.
PAFIS. This one kind of guides you on how to use a fire extinguisher correctly.
Oh, yeah.
So it's pull the pin,
Right.
aim at the base of the fire, squeeze the lever, and sweep from side to side.
It's funny, these simple acronyms,
Right. I know, they're so helpful.
they really make a huge difference in these high-pressure situations.
Yeah, because you panic and you're like, wait,
Oh,
what?
no.
What do I do? And it's like, oh, right. Pass.
It's like a mental checklist.
Totally.
It's right there.
Yeah, okay. And then there's one, this one I think we hear all the time in the medical dramas too. It's STAT, which we always hear, and it seems so dramatic. But really what it signifies is just an urgent need for immediate action, right?
Right. It means, right now. This is
like drop everything.
ancient. Yeah.
This needs to happen now.
And so the curriculum, emphasizes how crucial it is for CNAs to recognize when a situation warrants a stat call.
Right.
Because they're really the eyes and ears on the front lines.
Yeah, absolutely.
Often the first to notice subtle changes in a patient's condition.
That makes sense, yeah.
So it's not just about following orders, right? It's about
Taking the initiative.
having the judgment and the confidence
Yeah.
to escalate a situation when necessary.
Okay, so now let's shift gears just a little bit.
Okay.
Let's talk about some general safety rules because obviously safety first, right?
Always. You can't have effective care without a safe environment,
Right.
both for the caregiver and the person receiving care.
That's a good point.
Yeah. And the curriculum really doesn't shy away from emphasizing the importance good of the CNA's own well-being, right?
Right.
So it stresses the need for them to follow protocols
Uh-huh.
meticulously and report any concerns immediately.
Yeah.
And most importantly, know their limitations.
Which can be tough, right? Because you want to help.
Yeah, I mean, it's not a sign of weakness, right?
Right.
To ask for help or clarification.
No, totally.
It's actually a sign of professionalism.
Absolutely.
Because if you push yourself beyond your training,
Mm-hmm.
you can put both you and the patient at risk.
Yeah, that's a really good point. Okay.
And speaking of risks,
Oh, here we go.
let's dive into the two most common culprits in healthcare settings: falls and burns.
The dynamic duo of danger. Dun, 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 dun.
That's right. I mean, the curriculum drops a pretty startling statistic here.
Oh, I love a good statistic. Let's hear it.
70% of accidents in these settings are falls.
Wow, 70%.
70%.
That's a really high number.
And here's the kicker.
Okay.
They often happen during shift changes.
That is really surprising to me.
Yeah, and it really highlights the importance of communication, and vigilance, like really being careful during those transitions.
I wonder why it's so much higher during shift changes, though.
Well, imagine, right?
Yeah.
You've got one CNA handing off care to another.
Yeah.
And if there's any miscommunication about, a patient's mobility or fall risk, right?
Right.
That can create a real window of vulnerability.
I see. Yeah.
And it's a good reminder, I think, for anyone listening, even outside of healthcare, to be extra cautious during those transitions and handoffs.
Totally.
Especially when caring for someone who's vulnerable.
Yeah, that makes sense.
So.
Okay, now let's talk about burns.
Burns.
Which the curriculum is pointing out that it can occur from all sorts of things, right?
All sorts of things.
Man, it could be hot drinks, it could be heating pads.
Oh, yeah.
All sorts of stuff.
Exactly. It's not just open flames we need to be wary of.
Right.
Right. Even seemingly harmless items.
Right. You'd never think about it.
Like a hot water bottle or an electric blanket.
Right. Could pose a burn risk.
If not used properly.
Yeah. Okay.
It's a good reminder for all of us, right?
Yeah.
To be mindful of those temperatures and to always err on the side of caution when you're handling anything hot.
Right.
Especially around anyone who might have,
abuse sensitivity or mobility issues.
Yeah, reduced sensitivity or mobility issues.
Totally.
And knowing that basic first aid for burns
Yeah.
is absolutely essential.
Totally.
Right.
Okay, so good reminders.
Yeah.
Okay, now speaking of hazards,
Okay.
fire safety.
Yes.
Huge area
Yeah, big one.
where CNAs need to be super vigilant.
And the curriculum reminds us of a really kind of sobering fact.
Okay, let's hear it.
Smoking is the #1 cause of fires.
That's not surprising, but it is kind of scary.
Right. And even though most healthcare facilities are smoke-free these days,
Yeah.
it only takes, one careless act to spark a disaster.
Totally.
So that's why that vigilance is so important.
Okay, and then when we're talking about fire prevention,
Yes.
you've got the fire triangle.
The fire triangle: fuel, heat, and oxygen.
Yes.
Such a powerful visual, right?
Yeah.
Like you remove one of those, you break the chain, and you prevent a fire from igniting.
Yeah, you got it. You need all three.
Right.
Okay, that's really helpful.
Well, if you eliminate the fuel source, right?
Yeah, like keeping flammables away from heat.
Right.
Okay.
Or you can cut off the oxygen supply.
But like you smother it.
Yeah, like with a blanket.
Okay.
Right.
Yeah. That's really good visual.
And it's so simple but powerful, right?
It is, yeah.
It can really help us all
Totally.
think more strategically about fire safety.
Yeah, I like that. Okay. So now speaking of elements that are both essential for life,
but
also
dangerous,
can be dangerous, let's talk about oxygen therapy.
Oxygen, right?
Right.
The life-giving gas that's also,
highly flammable.
highly flammable.
Talk about a double-edged sword.
A real double-edged sword.
So while we know that it's essential for a lot of patients,
Right.
it also, introduces a significant fire risk.
It does, because you're literally fueling the fire, right?
Yeah, exactly.
So the curriculum is so meticulous
I bet.
about the safety protocols related to oxygen.
Yeah.
CNAs are trained to recognize and mitigate potential hazards,
Makes sense.
like ensuring no smoking signs are up, keeping the oxygen tubing free of kinks,
Yeah.
and avoiding flammable materials near those oxygen sources.
So really it's all about just that balance, right?
It is. It's about striking that balance.
Providing that life-saving benefit, but also being aware of the risks.
Yes, totally.
Yeah, okay, that's really interesting.
It's like walking a tightrope, isn't it?
It is.
And that brings us to another topic,
Okay.
where the line between care and control can get a little blurry.
Oh.
Postural support,
Postural supports, okay.
more commonly known as restraints.
Oh, okay.
Restraints are definitely like
A touchy subject.
a touchy subject.
I was going to say.
Yeah, and the curriculum,
Mm-hmm.
approaches it with a lot of sensitivity.
Good.
Yeah, it's very clear that the purpose of these devices is to prevent harm,
Yeah,
not to punish or control.
that's good. That's an important distinction.
It is, and there are serious ethical and legal considerations, right,
I bet.
to weigh.
Yeah.
So the curriculum really hammers home the importance of informed consent,
Right.
respecting patient rights, and understanding the potential psychological impact
Oh, yeah.
of restricting someone's movement.
Yeah, you can't just, tie somebody up.
I mean, imagine, right, being confined
Yeah.
to a bed or chair against your will.
Right.
I mean, it can be incredibly frustrating
Yeah,
and dehumanizing.
for sure.
So that's why the curriculum stresses that restraints should always be the last resort, right?
Right.
Only used when all other options have been exhausted.
Right.
And the patient's safety is at risk.
Okay, so it's really about exploring every other avenue first.
Right. Can the environment be modified? Are there other strategies that might be effective?
Okay.
And it's about recognizing that every individual deserves to be treated with dignity and respect.
Right.
Even when they're in a vulnerable state.
I like that a lot. Okay.
So even when restraints are deemed absolutely necessary, the curriculum outlines very strict guidelines. Right?
Like what?
Like the two-finger rule, right?
The two-finger rule for checking tightness.
Yes, exactly.
I know about that one.
To make sure it's snug but not constricting.
Okay.
So that there's proper circulation.
Makes sense.
And there's a big emphasis on that regular repositioning, right? Monitoring for any discomfort or distress, and ensuring the patient's basic needs are met.
Okay, so it's really about minimizing the impact of it.
It is minimizing the impact.
But still prioritizing their well-being.
That's right. Very delicate balance.
Yeah, for sure. Okay, now let's shift gears again for a minute.
All right.
And talk about something that might surprise you.
Whoa. Okay.
Bioterrorism preparedness.
Bioterrorism preparedness. That seems a little...
Right. Out of left field.
Out of left field, yeah.
But, think about it.
Okay.
In the event of a bioterrorism attack, hospitals would be...
on the front lines.
On the front lines.
Right. And CNAs, with their training in infection control and basic life support, would play a crucial role in responding to such a crisis.
Yeah, absolutely.
So the curriculum, doesn't delve into specific protocols.
Okay.
But it does define terrorism and potential threats. And even the National Terrorism Advisory System.
What is that?
Well, the National Terrorism Advisory System, or NTAS, it's a vital tool for sharing information about potential threats.
Okay.
And it replaced the old color-coded system.
Oh, wow.
With a more streamlined approach.
I see.
It's got 2 threat levels now, imminent threat and elevated threat.
Okay.
And each alert has what they call a sunset provision.
Okay.
Meaning it expires after a specific time.
Okay.
So the information stays relevant.
Right, up to date.
Exactly, yeah.
Okay.
It's all about empowering people to make decisions.
Right.
And take precautions in dangerous situations.
Yeah, okay.
So even though it seems far-fetched, the curriculum recognizes that CNAs could be on the front lines of something like that.
Yeah, and they need to know,
right. And having a basic understanding
can
make a huge difference.
Totally. It's all about being prepared.
That's right.
Right. You never know what you're going to face.
Especially in healthcare.
Especially in healthcare. Yeah, totally.
Exactly.
Okay, that's fascinating.
Yeah, so we've covered a lot of ground here.
We have.
From fire safety to oxygen therapy to even bioterrorism preparedness.
Restraints. Yeah.
What stands out to you?
I think the thing that stands out to me the most is the CNA's role in creating that safe environment.
Yeah.
Not just for the patients, but for themselves.
That's a good point.
It's not just about following those rules, but it's like you were saying, being observant, proactive, having that confidence to speak up when something seems off.
Like being a vigilant advocate for safety.
Yeah, I like that.
Yeah.
Okay, so how can somebody who's not a CNA apply these principles to their own life?
Well, it's really about cultivating that safety mindset, right?
Yeah.
Like always being aware of those potential risks and thinking about how to prevent those accidents.
Totally.
And, a lot of the principles like fall prevention, basic first aid, fire safety, all relevant to caring for loved ones.
Yeah, especially as they age.
Or
maybe face health challenges.
Right.
Yeah, that's true. So it's like having that toolbox of skills, right?
That you can use to be a better caregiver, better citizen.
Totally, and just like a more prepared person.
Yeah, exactly, in any situation.
Okay, awesome. So I think that's a great place to end part 1.
Yeah.
But stay tuned, because in part 2, we are going to continue this conversation.
Right. And we got some really interesting stuff coming up.
We do.
So stay with us.
Yes, we'll be right back.
Welcome back.
So, as we were going through all that, all those protocols and safety measures and stuff, I was thinking about how being a CNA isn't just about those technical skills, It's about developing a real sense of
awareness,
and observation.
Yeah, like they develop the 6th sense.
Right.
For potential hazards. Like they're always scanning the environment, looking for anything that could be a risk.
And I bet experience plays a big role in that too, right?
Oh, totally. The more time you spend in these settings,
Yeah.
the more you start to pick up on those cues.
Right.
And those patterns.
Yeah.
You learn to anticipate those
Really,
problems.
it's like they're always thinking one step ahead.
Exactly, yeah. An ounce of prevention is worth a pound of cure, right?
I love that saying.
And the curriculum really drives home the importance of that proactive care.
Uh-huh.
It's about recognizing those early warning signs,
Right.
right? Whether it's a patient showing signs of agitation
Yeah.
that could lead to a fall, or
Yeah.
like a frayed electrical cord,
Right.
that could be a fire hazard.
So it's really about spotting those things.
Yeah, it's like playing a constant game of what's the hazard.
I like that.
Yeah, but it's not just about spotting the obvious things, right?
Right. Yeah.
It's about understanding those underlying factors that contribute to the risk.
Okay. So can you give me an example of that?
Sure, let's think about fall prevention, okay?
Okay.
So a CNA who's really in tune with their patients won't just, make sure the bed rails are up.
Yeah.
They'll consider things like
Oh, okay.
medication side effects
Oh, right.
that might cause dizziness.
Right. Or changes in how they walk. Yeah.
Exactly, or if the patient seems like they're rushing to the bathroom or they seem disoriented.
Right. Okay.
So it's really about connecting those dots,
I see. Yeah.
looking at the whole picture,
The bigger picture.
and considering all those factors
Yeah.
that could increase that risk of falling.
Okay. That's really interesting.
And this holistic approach really applies to so many aspects of care.
Uh-huh.
Think about oxygen therapy,
Okay.
right? A CNA who's thinking critically
Yeah.
won't just check that the oxygen tank is full.
Right.
They'll pay attention to the patient's breathing,
Oh, okay.
their skin color,
Right.
their level of alertness.
So it's about more than just checking the box, basically.
Yeah, they're constantly assessing
Right.
and reassessing those needs.
That makes sense.
Right. And that level of vigilance, especially critical
Yeah.
when dealing with those complex procedures or sensitive situations, like restraints.
Okay.
Yeah, we talked about how those should always be a last resort.
Right.
But even then,
Uh-huh.
it's not just a matter of,
Throwing them on.
slapping them on and walking away.
Right.
The curriculum is really clear about the need for ongoing monitoring and assessment, checking circulation, repositioning regularly
Right.
to prevent those pressure sores, providing opportunities for movement, range of motion exercises.
Okay. So it's really about minimizing that impact.
Exactly. Minimizing that impact while still ensuring their safety.
And I guess recognizing that every patient is an individual, too.
Right. Exactly.
With their own needs and preferences.
What might be an acceptable level of restraint for one
Yeah.
could be totally different for another.
That's a good point.
Right.
Okay.
So it's about that balance again.
Yeah, balance. Always that balance.
Safety and autonomy.
Okay.
And it really requires
Mm-hmm.
that deep understanding of the person.
Yeah.
Their medical history, their
Yeah.
cognitive abilities, their emotional state.
So really seeing them as a person,
As a whole person.
Yes.
Yeah, like that. Okay.
not just a set of symptoms.
Right.
Right. And that's where communication is so vital.
Uh-huh.
CNAs are often that link
Right. They're right there with them.
between the patient and the rest of the healthcare team.
Okay.
Right.
Yeah, that makes sense.
They spend the most time with the patient. They're observing their behavior,
Uh-huh.
listening to their concerns,
Right.
noticing those shifts in their mood
Okay.
or condition.
So they're gathering valuable information
Yes.
about how to best care for them.
That can inform those treatment decisions.
I see.
Right.
Yeah.
So that's why the curriculum emphasizes clear and concise documentation.
Okay.
They need to be able to articulate those observations, right?
Makes sense.
So everyone's on the same page.
So it's really like they're almost like writing a story in a way.
They are. They're writing the story of the patient's day.
Okay, I like that analogy. Capturing those little details
Yeah.
that might be missed otherwise.
Okay, that's really interesting.
And those details can make a world of difference in providing that really personalized and effective care.
Okay, so we've talked a lot about the technical side of all
Yeah.
of this.
All right.
But this curriculum also highlights the importance of human connection.
Absolutely. At the end of the day, CNAs are providing more than just physical care, right?
Right.
They're offering companionship,
Yeah.
emotional support, a sense of human touch.
Which is huge,
That can be so vital.
especially for those who are isolated or feeling vulnerable.
Absolutely. So it's about recognizing that every interaction,
Mm-hmm.
every touch, every word of comfort
Right.
can have a huge impact on a patient's well-being.
Okay, now going back to when we were talking about bioterrorism preparedness.
Right.
It made me think,
CNAs might find themselves on the front lines of other situations, too.
Of course, right.
Like natural disasters, maybe?
Yeah, think about a hurricane or an earthquake.
Yeah.
Right? Hospitals would be overwhelmed, and CNAs would be essential in providing that basic care.
Yeah.
Assisting with evacuations, maintaining order
Wow.
amidst all the chaos.
So it's more than just, day-to-day patient care.
Yeah, it's about being adaptable.
Right.
And thinking critically, being a team player.
And those are valuable skills no matter what you're doing.
Exactly. They're essential for navigating life's unexpected twists and turns.
That's a good point. So, we've been talking a lot about how demanding this work is.
Yeah.
Physically and emotionally, right?
Yeah, it's not for the faint of heart.
For sure. But despite those challenges,
Yeah.
there's got to be a lot of satisfaction in it.
Oh, there is. There's a deep sense of satisfaction.
Right.
Knowing you're making a real difference in people's lives.
And the curriculum also touches on that self-care and stress management.
Yes. Recognizing that you can't pour from an empty cup.
Right.
If you're not taking care of yourself. You won't be able to take care of your patients.
So finding that balance.
That's right.
Being dedicated, but also taking care of yourself.
And knowing when to ask for help.
Right.
Right.
Absolutely.
And that you're not alone.
Yeah.
There's a community.
Okay, so we've talked about a lot of stuff.
Yeah, we have.
Creating a safe environment,
What?
the critical thinking, the balance of safety and autonomy, and that human connection.
What's the one message
Yeah.
you want our listeners to take away?
Yeah. What do you hope they take away from this?
Well, even though we're focusing on a CNA training curriculum,
Yeah.
the lessons here really extend beyond healthcare.
Right. Totally.
I mean, we can all benefit from this stuff.
Right.
That safety mindset, being aware of our surroundings, that clear communication,
Right.
the compassionate care.
Yeah. Okay.
So taking these principles and applying them to our families, our friends, our colleagues,
Yeah.
it's about recognizing that we all have a role to play
In creating that safe world.
in creating a safer and more caring world.
That's a good takeaway.
Yeah.
Okay, so before we move on to part 3,
Right.
I'm going to leave our listeners with a thought-provoking question.
Oh, we love those.
Think back to our discussion about restraints
Okay.
and that whole idea of balancing safety and autonomy.
Yeah.
Imagine you're a CNA caring for a patient with dementia who keeps trying to get out of bed,
Right.
even though it's not safe for them.
Mm-hmm.
You've tried everything, distractions, reassurance.
Right.
You've even modified the environment. Nothing's working.
Yeah. What do you do?
What do you do? How do you balance those risks?
It's a tough one, right?
Yeah.
It really is a situation that many CNAs face.
Yeah, I bet.
So we'll delve into those ethical considerations
Okay.
in part 3. So stay tuned.
Welcome back to the final part of our deep dive into the CNA world.
Yeah, it's been quite a journey, hasn't it?
It really has. And, we left our listeners with that ethical dilemma.
Oh, right. The patient with dementia who kept trying to get out of bed.
Yeah. And how do you balance keeping them safe with also respecting their autonomy?
Right. It's a tough one. And the curriculum really doesn't give those easy answers.
I bet.
Which I think is a good thing.
Yeah.
It encourages you to really think about these situations.
Yeah. To think critically.
Yeah, and consider that individual's needs.
Right.
And, consult with the rest of the healthcare team.
So it's not just about following the rules. It's about really using your judgment.
Absolutely. And your compassion to find that best solution.
Okay.
And that involves a lot of creative problem solving.
I bet.
Thinking about okay, what's the reason for this behavior? Are they in pain?
Oh, good point.
Are they confused?
Right.
Disoriented?
Trying to go to the bathroom.
Yeah, exactly.
Yeah, so it's really about being a detective almost.
It is, trying to figure out what's going on.
Figure out what's really going on and what's causing that.
Exactly. And it involves close observation, communication, and a willingness to try different things.
Okay.
Right. Maybe listening to music would help.
Oh, yeah.
Or having a consistent routine.
Okay.
Or a familiar object nearby.
Yeah.
To provide that comfort.
Okay.
So it's about thinking outside the box a little bit.
I see, yeah.
Recognizing that everyone responds differently.
To different things.
Exactly.
Okay.
And sometimes even with the best efforts, restraints might be necessary.
Right.
But even then, the curriculum talks about using them with respect and dignity.
So it's about making them feel safe, not punished.
Exactly.
Right.
And it's about making sure that they're used for the shortest possible time.
Okay.
With constant monitoring to see if they're still needed.
Okay, so always reassessing.
Always reassessing.
Okay.
And recognizing that, even in those toughest situations, everyone deserves to be treated with compassion.
It's really become clear that being a CNA is more than just a job.
Oh, absolutely.
It's a calling.
It is a calling. It requires such a unique blend of knowledge and skills.
And heart.
And heart, most importantly.
Right.
You have to have that genuine desire to help others.
I think you're right.
Yeah. And that sense of purpose can be so rewarding.
And we've been talking about this all along, but that lifelong learning aspect.
Yes, the field is constantly evolving.
Right. So important to stay curious and informed.
It is. And there are so many ways to do that.
Oh, yeah.
Attending workshops, reading journals.
Talking to other CNAs.
Yeah, talking to colleagues.
And all of that benefits everybody.
It does. It benefits the CNA and it benefits the patients.
So we've really, I think, given our listener a really good sense of what it takes to be a CNA.
I think so, too.
All the technical skills, the safety, the ethical considerations.
Yeah, the human connection.
The human connection.
And ongoing learning.
So as we wrap up, I want to leave our listeners with one final thought. Whether you're thinking about a career in healthcare, or maybe you're caring for a loved one, or just navigating life, remember those lessons that we talked about today.
Yeah.
Cultivate that safety mindset, prioritize that communication, approach every situation with empathy and compassion, and never stop learning.
Beautifully said. And to our listener, thank you so much for joining us on this journey.
Yes, thank you so much for listening.
We hope you found it as insightful and inspiring as we did.
We'll see you next time. Bye.